We make the journey to pathways of liberty and wise, certain of our destination and the deeper meaning of our mission. We answer and appeal for help, have compassion for our brother's pain. With happy hearts we pave the way for a better health of the family. Move onward, family physicians. Keep striving for excellence. Let's work with concern and serve with commitment, for we are the keystone to a healthy nation. Move onward, family physicians. Keep striving for excellence. Let's work with concern and serve with commitment, for we are the keystone to a healthy nation. Move onward. Family physicians, keep striving for excellence. Let's work with concern and serve with commitment, for we are the keystone to a healthy nation.
Good afternoon, everyone. So happy Family Doctors Day. It is my pleasure to have you here in our webinar. But before we move on with our presentation, let me introduce to you our moderator for this evening's activity. So our moderator is Dr. Emery Gold V. Untong. So Dr. Untong is actually a diplomate of the Philippine Academy of Family Physician. She is a graduate of the UERM College of Medicine and had her residency training in family and community medicine at UPPGH. Presently, she is the chief of hospital of the Rizal Provincial Hospital, Hala-Hala branch, which is the farthest municipality in Rizal. So friends and guests, please join me in giving a warm welcome to Dr. Emery Ballesteros Untong. Goldie?
Thank you very much, PJ, for that warm introduction. Good evening, dear colleagues. Good evening, our dear students, our dear interns. Happy World Family Doctor Day, everyone. We are currently 181 in attendance. We are very fortunate to be joining this special lecture tackling about career in family medicine. In the upcoming minutes, we will be discussing more about this specialty. For now, let's hear welcome remarks from our esteemed President of the Philippine Academy of Family Physicians, the Chair of the Department of Family and Community Medicine at UPPGH. Let's all welcome in our virtual stage, Dr. Karine Estepa Garcia. Hello, ma'am.
Good evening. Thank you, Goldie, for that introduction, and a pleasant evening and wonderful evening to all. In behalf of the Philippine Academy of Family Physicians, thank you, my dear students and participants, for joining us once again in our featured webinar entitled The Career Talk in Family Medicine. This session is part of the numerous activities lined up for our World Family Doctors Day. I am aware and extremely proud of these activities, which actually are combined activities from our chapters and training programs. We have radio and television guestings, lay forums, postgraduate courses, sports activities, TikTok, logo contests, community health screenings, and many more. This just ascertain your commitment, the commitment of family physicians and their passion to the discipline by spreading awareness and sharing our knowledge and expertise, most especially in primary care. Indeed, family physicians beat us one in being patient-centered, family-focused, and community-oriented. We are hoping that more will heed to this calling, and this forum is a timely opportunity for all the young students, interns, future practicing doctors to listen to physicians, namely Dr. Zoraida Leopando, Dr. Isabelita Samaniego, Dr. Florentino Berdin, and Dr. Lynn Alba Concha, who chose family and community medicine as a career and are now trailblazers in their own fields and practice. I would like to take this opportunity to thank in advance our panel of reactors, former Dean Alfareta Reyes, Dr. Attorney Joy Agoot, the PAFRO President, and Abdul Rauf Garangan, the President of the APMC Student Network. We are looking forward to hear your responses and the reactions. And of course, the Working Committee on External Affairs and Stakeholder Engagement, headed by Dr. PJ Francisco and Goldie and the team of Dr. Cherry Oro. So to all our family physicians who are with us tonight, May 19, we celebrate World Family Doctor Day. So I hope you can all press your hearts to show your support and appreciation to our family doctors. As I lead in greeting everyone again, Happy World Family Doctors Day. Mabuhay ang alagang may puso. Mabuhay ang family doctors. Maraming salamat po.
Thank you, Doc Karine. Mabuhay indeed, no? Very busy day today, no? Si Doc Karine, napakaraming interview right and left for our World Family Doctors Day. I can see people raising their hands, so probably later we will get back to you, dear doctors. But for now, ayoko na pong patagalin pa. At syempre, nandito sa ating virtual floor ang sabihin na nating haligi, the pillars of family medicine here in the Philippines. First is Dr. Leopando. She is the professor and chair of Department of Family and Community Medicine and Community Health College of Medicine at Our Lady of Fatima University. She is our professor emeritus at UPPGH, founding president at the Foundation of Family Medicine Educators, editor-in-chief of Textbook of Family Medicine, a fellow of WONCA, World Organization of Family Doctors. Actually, she is a mentor to me. I look up to her, no? Dr. Leopando, siya yung isa sa karabing elbow niya ang mga people in WONCA, the World Organization of Family Doctors. So she will be our first speaker. Our next speaker So we have three different speakers for tonight's activity, no? So our next speaker is Dr. Isabella A. Morales Samaniego. She is a full-time professor at PLM College of Medicine. She is also the Chairman Emeritus of PLM Hospital ng Maynila, Department of Family and Community Medicine, and she is currently a practicing family medicine physician. Next is Dr. Florentino M. Berdin. No? Dr. Berdin is a past president of PAFP Cebu chapter, associate professor at the University of Cebu College of Medicine Foundation Incorporated, and currently he is the chair of Department of Family and Community Medicine at Cebu South Medical Center. He is a fellow of the Philippine Academy of Family Physicians. So now I will give the floor to our distinguished speakers for tonight's activity. Hello, Dr. Leopando. Okay. So while waiting. Hello, Dr. Dada. Ayan. So we are now 217 in attendance, no? Some of the attendees are students, residents, no? And those who are still thinking of their specialty, as what Dr. Garcia mentioned. Hopefully, you can heed the call because we need more family doctors, no?
Okay. Can you hear me
Yes.
now? I was
Yes,
muted
yes.
earlier. Okay.
Yes, Doc Dada, we can
Yeah.
hear you, ma'am.
So happy Family Doctors Day, no? We started celebrating, I think, more than 10 years ago. And it's not only, this is universal around the world with 110 member countries, no, of WONCA. And here in the Philippines, it is also a legal activity because we were able to get presidential proclamation from President Pinoy, no, to celebrate the National Family Doctors Day. Yeah, what happened?
Yes, Ma'am Dada. Can you change your PowerPoint into a slideshow po?
Yeah.
Okay. Thank you, ma'am.
Okay. So Martin Luther King said, inequality and injustice in healthcare is the most shocking and the most inhuman. And Ban Ki-moon, who was one of the former Secretary General of the United Nations, said, universal health coverage and investment in health systems can accelerate global efforts to ensure access to healthcare to anyone who needs it, leaving no one behind. So I will discuss the PAFP, Family Medicine Education, Universal Healthcare in 10 minutes, and in the evolution, PAFP started as the Philippine Academy of General Practitioners, and in 1972, it was recognized as a specialty society by the PMA, changing its name into Philippine Academy of Family Physicians. It became a founding member of the member organization of the World Organization of Family Doctors in WONCA, and it started specialty board examination in 1979, and in 1984, it became the lead specialty society in family and community medicine by the PMA. There is growing importance of family and community medicine in medical education. In 2006 to 2016, I think there is some, wait. 1978, we had the Declaration of Alma Ata, which strengthened primary health care so that we can attain health for all. That was by the year 2000. But health for all means all citizens of the world will have an economically and socially productive life. It was never the intention na walang magkakasakit na tao sa buong mundo. Kasi imposible yun. In 1994, the WHO and the WONCA had an invitational workshop on making family medicine and family medicine education relevant to the healthcare needs. And this was held in Canada, and I was one of those invited to participate. In 1995, the Philippine Society of Teachers of Family Medicine was organized to be the academic arm of the PAFP and to take charge of training of teachers and anything academic, including the curriculum. And the name was changed to the Foundation for Family Medicine Educators. In 2006, 2016, CHED issued a memo, CHED Memo 6/2006, and it was reiterated through CMO 10/26. And there they identified family and community medicine as one of the courses for basic medical education. Because of the 2006 memo, medical schools participated in the formulation of the integrated curriculum in medical education for all medical students. And the curriculum is actually integration of family and community medicine in medical education for all. And in 2014 and 2015, we had the textbook in family medicine, volume 1, published in 2014, and volume 2, published in 2015. So, how did the Philippine Academy of Family Physicians responded to changing healthcare system? In 1995, the National Health Insurance Law was enacted. And the year after, the PAFP organized a workshop on gatekeeping physicians. It identified the competencies of gatekeeping physicians, which stated that all primary care physicians should be able to address majority of the problems of all the people who come to see them, regardless of age and gender. In 1998, the PAFP, through a workshop participated in by chapter presidents and heads of departments and PAPRO officers and the board, of course, they formulated the competencies of the family physicians divided into definitive competencies and selective competencies. Some are still using these as reference. In the same year, the UP College of Medicine, PGH, launched the Master of Science in Community Medicine, Family and Community Medicine. It's a teacher, researcher training with students coming not only from the Philippines, but from Indonesia, Vietnam, and Myanmar. And we can say that through this course, the Indonesian family medicine was strengthened, and the same in Vietnam and Myanmar. In 2002 and 2006, we started the Quality Assurance Workshop in Family Practice and Education, enabling the family physicians to engage in quality assurance activities. And it was actually planned to have a QA circle in all the chapters, but that is something that we hope will happen. And in 2006, we have the workshop on quality practice in family medicine with a handbook published. 2013 and ongoing, there is a partnership between the PAFP and the DOH, reestablishment of family medicine residency training program in all the DOH regional hospitals. And this was fully accomplished in 2022. Okay. And it also said the directive from the DOH also said that for those who already have, because in 2013 there were already 9 residency training programs in DOH hospital, they should enhance existing program with the inclusion of practice-based family medicine residency training program. And Zamboanga was one of the Zamboanga City Medical Center was one of the first to organize this within the DOH hospital. Although in the private sector, St. Jude Hospital started the practice-based training for practitioners. 2014 and ongoing, the Foundation for Family Medicine Educators launched the Academic Fellowship Program for Family Medicine Educators. This is in response to the new family medicine programs established, because we felt that it's not enough that we have several programs with chairs and training officers who were fielded without preparation to be academicians. And this helped improve the implementation of the programs. 2019 and ongoing, the Universal Healthcare Law was enacted in 2019. There were a group of family physicians who lobbied for the enactment of the law and for inclusion of definition of primary care physicians and the roles of primary care physicians, the 6 roles. We ensured that it will be included in the law. And in 2022, when there was a workshop organized by the DOH about Specialista para sa Bayan, it was recommended in that workshop that all municipalities in the Philippines should have specialists, and these specialists should be family medicine specialists. So let's look at the vision. In 1994 to 2021, Dr. Angeles, our founding president, had a slogan, a family physician for every Filipino family. And when we had the first operational planning workshop of the Philippine Academy of Family Physicians, it was adopted as the vision of the PAFP up till 2021. If you look at this diagram, this is curve-white diagram. In the left side, if there are 1,000 adult people, 750 of them will have some symptoms, but they don't go to visit doctors. 250 will visit any facility, and around 90 will go and be admitted to any hospital, and only one will be admitted in a tertiary hospital. This was 1960. And this is probably the reason why rotation in the community was done in all the schools here in the Philippines, so that they will see this 1,000 population of which 750 will have symptoms, because only one of that 1,000 will be in academic medical centers where the medical schools and medical students are. In 2002, this was repeated. The ecology of care was repeated. And what did it show? Of the 1,000 population, both adult and children, 800 will report systems, 327 will consider seeking medical care, 217 will visit a physician's office, 66 will visit complementary and alternative medical care, which we did not see before. 21 will visit hospital outpatient clinic. 14 will receive home health care, which we did not see earlier also. 13 will visit emergency medicine department. And 8 will be hospitalized. And only one, again, will visit an academic medical center. this study showed that medical students should have experience in primary care, and if possible, we should be able to encourage 50% of the medical students to go into family medicine when they graduate. So this model highlights that 90 to 99% of the healthcare needs of the population can be addressed by primary care. And if so, we should have more doctors going primary care. So how was the journey in the Philippines towards universal health care? In 1954, we have Republic Act on Rural Health Unit, indicating that all municipalities should have rural health units and all provinces should have provincial health officers to look into rural health unit. In 1969, we had the Philippine Medicare Act, and in 1987, for the first time, we had the Constitution of the Philippines with provisions on health. In 1995, we had the National Health Insurance Act for which we conducted the competencies of gatekeeping positions. And in 2013, we had the Kalusugang Pangkalahatan. And that's when we had the workshop on sustainable universal health care through primary care anchored on family medicine. And that was in 2013. In 2016, we were already discussing within the PAFP the possibility of having a universal healthcare law encouraging family physicians to join the law so that the patients they have been taking care of for 10, 20, 30 years can still go to them because they are part of the universal care program. And true enough, in 2019, we have Republic Act 11223, which is the Universal Health Care Act. And what does it say? An act instituting universal health care for all Filipinos, prescribing reforms in the healthcare system and appropriating funds thereof. What is the timeline? It was signed in 2019, taking effect after it was published in March in the official gazette. The implementing rules and regulations were conducted 180 days from effectivity, and it was done in Northern Luzon, in Central Luzon, with NCR, in Visayas, and in Mindanao. And we encourage our leaders in these areas to participate in the seminar where they discuss this. The pilot implementation in 33 UHE areas was started in July to December 2019.
Ma'am Dada,
Yes.
yes, my apologies po, but your slides are not moving.
Yeah, hindi pa ako nagpalit.
Okay, sige po.
Anong nakita mo? Yung timeline?
Ecology of medical care, ma'am.
That's not the one. I already... This one? This you did not see?
Ma'am, maybe, may I suggest that you stop share and then reshare ulit po your presentation?
Wait. Kasi bakit nag-stop? Resharing is, wait. Share. Wala. Okay. Can you see? Can you see now?
Yes, ma'am. Pa-screen share slideshow na lang po siguro.
Ito, slideshow. Naka-slideshow na ako from current slide. Okay, so ito yun, nasabi ko na ito kanina. And here, this is the timeline. So, by the end of 2022, it's now 2023, the registration with primary care physicians should have finished, so that the DOH has already issued the requirements and the licensure process to be licensed as a primary care facility, because PhilHealth will only contract those who are licensed by the DOH or its representative. And Consulta package is now ongoing. Consulta registration is now ongoing. And it is envisioned that by the end of 2029, there is full implementation of universal healthcare. We encourage all the 110 DFCM residency training programs to make a study of the communities they have adapted, how many of the families are already registered with a primary care facility, because we have to help. The vision, in response to the Universal Healthcare Law, the PFP amended the Constitution and bylaws, and the vision was changed into family physician of choice of Filipino families. And in a way, we are campaigning that we have to go to the communities, encourage them to register, and encouraging them to ask, is the primary care facility, does the primary care facility has a family physician? So today, this is the World Family Doctors Day. I discuss with you an important journey in family medicine education continuum, evolution of the healthcare system, and the role of the PAFP. The partnership between the DOH and the PAFP is still ongoing, and now it has included the training of the doctors to the barrios. After their master in public health management, they will train in family medicine residency training program to better equip them in primary care, in taking care of all the members of the family. And in the Department of Health, primary care physicians should have examination, assessment, so that they can qualify to be primary care provider. It is not, there is no formal paper yet, but the DOH has mentioned that pretty soon the PAFP will be the one to give the recognition to primary care physicians. It is in this regard why the committee had a ladderized training program for family physicians. After 1 year, they can already they can qualify to take the examination, so that they can already take in families or families into their primary care facilities. And also, we are hoping that all our members will also do that, so that they can be recognized by PhilHealth as a consulta provider. So I think that's all. And sorry for some misspelling here. Thank you very much. Yeah. I will stop sharing.
Okay, thank you very much, Dr. Dada Leopando, for that very historical background of our specialty. and giving us an overview of universal health care. No? And what struck me most is probably the medical ecology. But for now, we have to hear from our next speaker. No? Dr. Samaniego will be giving us another talk about this career. Go ahead, Dr. Samaniego.
Okay, good evening, everyone. I would like to take this opportunity to thank the organizers of this activity for inviting me in this career talk. Happy Family Doctors Day. This is the day that the Lord has made for us family doctors. Let me start. Please share, Dr. PJ. Please share the slides, Dr. PJ. Ay, nawala.
Ayan.
Ayan na. So let me start with a message from Mother Teresa. Have a special love for doctors. Yours is not only a profession, but a vocation. The vocation to be God's love, God's compassion, God's healing power to the suffering, and God has chosen you family doctors for a special mission. Being a doctor means going out and touching God in each of the suffering patients, whether it be the rich or the poor, for sickness strikes all. Next slide. Because we choose this vocation, our life's vision and mission must be that in all things God may be glorified through our work. This means that in every patient encounter, they will praise God because they met a doctor like you who satisfy their needs for solutions of their health issue, and to make sure that the image and likeness of our Creator will be not manifested in our behavior as doctors. This means that you are an embodiment of God's love and care for His people who are sick and suffering and needs your help. A friend priest once told me, you know, Doctora, your profession is more noble than us, priest, because you have the opportunity to heal both the body, the mind, and the spirit if you choose to share Jesus with your patient. Next slide. My only objective for this 15-minute session with you is to entice you graduating medical students to choose family and community medicine as your future career. Next slide. For several reasons. Because this specialty is the heart of the healthcare system. The family physician is the first doctor whom the patient consults as they try to seek help in their health problems. We project the type and quality of our healthcare system or the organization that we are representing. Therefore, you should not be cranky in dealing with patients. Secondly, this is the type of specialty that our country needs. Family medicine practitioners are one of the heroes during the COVID-19 pandemic as we bravely face the thousands of COVID patients needing our attention. We are at the emergency room, outpatient department, and if there is lack of manpower in the wards, the family medicine residents are called to assist. We rotate in various departments and learn their primary care cases. We are in the community health centers serving the poorest of the poor, and we develop projects that will help families and communities attain good health. Next slide. A family doctor is willing to see all types of patients in the different walks of life. In other words, age and gender does not matter. We are happy to see them all. We are the primary care specialists, meaning we see all types of diseases in its early stage of development. We champion the promotive and preventive aspect of health and disease, and because of that, there is less hospitalization and it is more cost-effective. Patients love to hear their doctors talk about their norms in life, best type of food for them, type of exercise, basic health issues that they need to face in their daily struggle. I have been a practicing family doctor for the last 44 years in San Pedro, Laguna. I am now seeing the fourth generation of families that are in my care since I started to practice this profession. I am their confidant, friend, advocate, and the first doctor that they see for any health issue. As a family doctor, I have patients who became mayors, vice mayor, barangay chairman, councilors. Several of them I was even able to circumcise. I had several patients who also became doctors, lawyers, and other professions. They are my patients since childhood. I know there are issues not only about health, but some of them can be very personal. Kung mahilig kayong magmarites, this is the right career path for you. Family doctors see patients from womb to tomb in the different stages of their family life cycle. What do I mean by this? Students would laugh if I tell them stories of some patients that at their young age bring their children for checkup. And outrightly, I tell them, oh, I know you since pregnancy test positive. What do I mean by that? During my younger years as a practicing family doctor, when a female patient consults for symptoms of pregnancy, I get their OBGYN history, do pregnancy test, which turned out to be positive. I do prenatal, deliver the baby later, then postnatal care, then do well baby and sick baby checkup. They grow up, and before you know it, years have passed, then you realize you have been seeing them in various health issues in the different stages of life cycle. Then one time they get married, sometimes they get you as their sponsor in their wedding. I had one patient like that. Few months after their wedding, this patient that I have been telling you suddenly had severe headache, vomited and went into coma. Was admitted at the ICU, Glasgow Coma Scale 4. She has been my patient since childhood, and I was requested by parents to see her. A referral was done to the neurosurgeon. CT scan showed ruptured brain aneurysm. Upon explanation, the family refused brain surgery. She eventually passed away at the age of 35. You are their doctor from inside the wound until the end of their life. All family, we also work in various places, like we work in the hospital, the community, industry, in the school, and health centers, whether it be in the government or private. Next slide. What are the characteristics of a family doctor? There are certain characteristics that you must have for you to become a good family doctor. First is good communication skills. As I've said, patients love their doctors if you are very gracious in discussing with them their health and non-health problems. They are happy if you outrightly tell them that they have to avoid this type of lifestyle because you know their family history very well because of the long history of relationship. A family doctor must show patience, gentleness, empathy in dealing with patients because we must understand the suffering that they are going through, especially to the poor who cannot pay you. Next slide. In choosing family medicine as your career, you need to reflect on the following goals that you want in your life. Is being a doctor your first choice of career? I ask this because I have met students when I was Dean of PLM College of Medicine who finished medicine, but they are not sure if they will practice it or not. Most just went through the College of Medicine without knowing their direction or goal in this life's journey. If you're not sure, then better start with family medicine. Then after that, get a subspecialty. Oh, we have several. You can go into hospice or palliative care, toxicology, geriatric, or occupational health. Do you plan to get married soon after internship? This will affect your decision on what type of specialty you will go into. If it's family medicine, you can get married after internship, even undergo residency training, since the stay in the hospital is just like in an office work and at least 2 days a week, 24 hours duty. You can even do clinics after your hospital work during weekends. Some FM doctors I know do online clinics either in the HMO or even in the comforts of their own home. What percent of your life on a day-to-day basis would you like to spend seeing patients? With family medicine, you can go on duty 8 to 5 p.m. 6 days a week. Since you are your own manager, you can close the clinic anytime you want. This is very important if you have your own family to take care. How fast would you like to achieve your goal to acquire the material things in life? I achieved this goal 1 year after residency, since I started having private practice after hospital work, and with even a meager PF of 5 pesos then. We were able to build our own home from a bank loan and was able to pay it in 5 years, buy a car and some other properties thereafter. You can even send your children to good schools and be able to go to countries that you want to visit. Next slide. It's easier to achieve the material goals if you are an entrepreneur. That is, you are not afraid to take risk in developing your own healthcare facility and be able to manage it. These are some of the qualities of an entrepreneur. Next slide. Next slide. The embodiment of a 6-star doctor is our Lord Jesus himself. As we read and know him in the Bible, we realize that he is a 6-star family doctor and even beyond. He is a healthcare provider who heals so many types of illnesses. He can easily mobilize so many people. He is their counselor, a teacher, and is always in the synagogue researching, and he manages his disciples very well. Next slide. Next slide, please. As a family physician, we also have that 6-star doctor qualities within us, which we can tap anytime if we pray and have a close relationship with him. Always pray for wisdom in anything that you do, so your endeavors will succeed. As a healthcare provider, we practice this to the best of our ability. As a counselor, we understand both the disease and illness, and we can explain this very well to our patients. As a teacher, we teach them preventive and promotive medicine and what causes their health issues. As a manager, we manage the health issues of the patient, the family, the community, and other types of clinic that we handle. We are social mobilizers. We lead the people in community programs to help solve community health problems. And as a researcher, we always do research because it is very important in the care of our patients for quality assurance. Next slide, please. Next slide. This is the view of the clinic early in the morning. Next slide, please. Next slide. So what are the rewards of being a family doctor practicing in the community? Of course, the love of your patient. You can feel this in everyday practice of medicine and in every patient encounter. Family time. You have enough of this after clinic hours. Respect of the community. Your words are always respected in any gathering that you attend. And of course, the financial reward. You will have lots of this. As I look back through the years of being a family doctor, I never regretted any part of it. And if I had another lifetime, I will still choose family medicine. I pray that many of you will choose this career. Thank you.
Thank you very much, Dr. Samaniego. I think during your whole presentation, yung face ko talagang it's very heartwarming. Thank you so much, Doctora, for sharing your personal anecdotes about your patients. No, iba din yung atake ni Doctora sa kanyang lecture. And now, another speaker will going to share about family specialty po. No, let's all welcome. And I see po there are already questions in the Q&A box. Later po we will answer that all, okay? And now let's all welcome Dr. Florentino Berdin Jr. in our virtual floor. Go ahead, Doc.
Thank you for the, allow me to thank you, the organizers for inviting me in tonight's activity. Hold on. Okay. So, maayong gabi sa tanan. At this point, I would like to greet each and everyone. Happy World Family Doctor Day. both the current practicing family physicians as well as our future colleagues in the field, that is our students and the clerks. Okay. Just like most of us who are about to take the board exams, and for those, sorry, sorry for the technical issues. Just like most of us, as I mentioned earlier, for those who are about to graduate and for those who are about to take the board exam, there's going to be a lot of decisions. There's going to be a lot of crossroads as you go along in your journey as a doctor. On my end, when I pass the board exam, I have to decide what specialty will I go into. And these are the things that I considered. The area of practice where I will begin my practice as a doctor after training, the work-life balance, and the opportunities that I will be having along the way. And of course, I would always that it always be my mantra to be happy in everything that I do. And a lot of people has been asking me why family medicine. And I would always, looking back to that day that I made the decision, I was sort of fast forwarding my life 5 years from after passing the board exam. And I visited my friends who were moonlighting then in Camiguin and in Malaybalay Bukidnon. And I realized I like to see patients regardless of their age range. I like to play with kids and I love talking with the elderlies. So when I get back home after 1 month of soul searching, that is when I applied in the training. So to be the 6-star family physician, that is being a healthcare provider, a researcher, an educator, a coordinator, a leader, and a navigator, allow me to share my journey as a family physician that I am today. Of course, I cannot be a family physician without my residency training program at the Cebu Institute of Medicine, Cebu Velas General Hospital. Mind you, this is the only residency training that I applied into. And when I was interviewed by our beloved Nanay Thelma Fernandez, that was sort of sealed the deal. And I looking back to that day, that was one of the best decisions I made. And that was, I think, I was in a crossroad, but I was definite which would I take, the left or the right. So after my number of years, that is 3 years residency training, in those 3 years, I was exposed to our community medicine that is in Pacnaan, Mandawi City. And I fell in love with public health. And I asked and sort of made talk with our chairman then, Dr. Fernandez, what would be my next steps after my training, which would sort of lead me to become a public health practitioner. And then she offered that the school would sort of support me and send me to study in UP, that is University of the Philippines, Manila, for the master's in public health. And after my training, after I immediately had my master's in public health in UP Manila. And when I came back, I was then asked to teach in the Cebu Institute of Medicine, my alma mater. And in between I had my clinics in Cebu City and in Lapu-Lapu City. And I am from Lapu-Lapu City. So Cebu and Lapu-Lapu City, that would be around 13 kilometers that I need to travel on a daily basis, catering to my patients, having 2 clinics at a time. And in between, I have the occupational health, the companies that I sort of work and be their company physician. To add more to it, I also accepted administrative work. It's those were the days that, yes, it was busy, but I didn't realize I also was in a mantra that the new happy is being busy. So I enjoyed my going from one aspect of being a family physician to another, being an educator, being a healthcare provider, being a leader and coordinator and all. Unfortunately, my love for public health was put on the side for the moment. And after that, a friend of mine enticed me, a family physician as well, enticed me to try and to go with her in Bahrain and work as a hospitalist at the American Mission Hospital in Manama, Bahrain. It's in Middle East. It was a humbling experience. It's a humbling experience in the sense that back home, here in the Philippines, doctors are the boss in a way. Unfortunately, when you are in a foreign country, you are the second-class citizen. So the people there, the Bahraini's, even the expats would be telling me what to do, what medicines to give. And you are forced. Initially, I tried to bargain, but I sort of there was an incident, and I have to share this to each and everyone. A patient shouted at me because I was in the middle of explaining everything, all the laboratories to the patient, and the patient just blurted out, "Stop the explanations. I want my medicine." And that was another decision that I have to make. Coupled with the unrest during that time in the Middle East, and as well as the clamor from my parents to go back home. After 2 years, I decided to come back home and pick up the pieces where I left. Again, I went back to be a clinician, having clinics in both Cebu City and in Lapu-Lapu City, and a faculty at the Cebu Institute of Medicine. Although at the latter part, around 7 years ago, I transferred to the University of Cebu School of Medicine. And I also have a couple of administrative works in 2 institutions, a clinic and a hospital. And that would sort of made me think that I was fulfilling the things that is expected of me as a family physician. But an opportunity knocked into my door, and that was during the Department of Health National Health Sector meeting held in Cebu last 2018. My friend, Dr. Eileen Espina, the very popular Eileen Espina, introduced me to the medical director of the then Talisay District Hospital, which is now Cebu South Medical Center. And the medical director asked me to join the hospital and to champion and be one of the champions in starting the universal health care in the hospital and start the training program in the department for the family medicine. And I am very excited at that time, and even now. And I joined the Cebu South Medical Center, and that was in 2018. At the same time, during the talk with the MCC, because looking initially, being a teacher is not on my top list as a career path, but realize being a son of a teacher, that sort of is part of my DNA. And I told the MCC then that yes, I will join the hospital as long as I will keep on teaching. So that was the history of my journey. And I know, I know that with the many crossroads that I've been into as a family physician, I still have a lot of work to become the physician of choice among our patients or among Filipinos. But with the way our residency training program is progressing, together with my consultants, our department, that is the Department of Family and Community Medicine of the Cebu South Medical Center, handling both the clean and the infectious outpatient department, and even handling
of the Philippine Academy of Family Physician. Let's all welcome in the virtual floor, Dr. Eleanor Alba Concha. Go ahead, ma'am.
Thank you very much, Goldie. Permission to share my slides.
Yes, Doc.
Apologies, my slides are not. I hope you can enable my slide sharing. But to our mentors here in the field, Dr. Leopando, Dr. Suman Diego, my colleague Junjet, our audience, our reactors later, our president, Doc K. Happy World Family Doctors Day. And I'd like to welcome the students who are here with us. Thank you. I can now share my slides. I hope you are seeing it clearly. So
Yes,
we posed
Doc.
the question, is a career in family and community medicine right for you? You've heard the developments in the discipline shared to us by none other than our guru, Ma'am Dada. You've seen the fruits of the practice shared by none other than Ma'am Ebby, along with the characteristics, the various practice settings that a family and community medicine physician can endeavor in. Dr. Berdin Junjet has shared with you his personal experience, and allow me to share my personal journey as well. And with this, I hope you can ask yourselves, is this the path that is for me? Am I willing to be a person who will be contributing to the country by becoming a physician in the front lines and serving to address the needs of universal healthcare? So I think every one of us has a journey. Each one would have a unique journey, as Dr. Berdin has shared to you. And you, by yourselves, as you went through med school and now contemplating on internship and later on residency, your context provides the clues, the steps that you will take in your journey. So just allow me to backtrack a little. I promise not to bore you with the details, but my pre-medical career has been a background in psychology, looking into humans and human behavior, and engaging as well in a socio-civic organization. From there, I saw that people's needs were basic, actually. Food, clothing, shelter, attention, information. That's what my organization taught me. During my medicine proper, I was very lucky to be provided with opportunities to go to the community, both by my mentors and also through the UP Ugnayan ng Pahinungot. My most memorable moment there that I think convinced me that we need more community doctors and we need more patient advocates was that in our third year of medical school, just right before clerkship, we were sent to the beautiful island of Aramayuan, Lamane, Quezon, Palawan. And we were a bunch of, I think we were 4 third-year students. We had 1 pharmacist and another BS biology from the UP system. We were sent there to this community. And one time early at dawn, people came knocking at our doors thinking already that we were physicians. And the emergency then was that someone was having severe diarrhea. A colleague and I had to walk to cross to get to the patient, and we had to transport the patient in a bangka through the open seas, about 30 minutes journey to bring them to a hospital. Right there and then, I thought, we really need more people. We really need more doctors, as Ma'am Abby said, practicing in the setting where the patients can access them. So of course, even if it was not sexy, it was not famous, some of my classmates were asking, why am I deciding to go into family and community medicine? I made up my mind. I would go to family and community medicine residency. And I think for me, the choice was a good choice, one that I will not regret. Why? The advantage of the residency is not only the rigors of training, which helped me to hone the roles further, but it was really to be in the company of mentors who've changed my perspective. Luckily, during my time then in residency training at the UPPGH Department of Family and Community Medicine, we had icons who fulfilled and focused on the different roles. We had a good clinician who also, like Ma'am Abby, stayed with her community. We had a researcher who we looked up to. We had a manager and a healthcare leader. We had a counselor who also counseled us. No? We had lots of educators, and we had health advocates and community consultants also engaging with the communities. Those experiences, so they're not in the textbooks, they're not something I can read, but as physicians, we know there's something you can model. And by exchanging ideas with these persons, my perspective widened. And during post-residency, after I finished my family and community medicine, they were the same mentors who gave me opportunities. So I was lucky I was able to go to certain hospitals, able to teach in med school, like the FEU, NRMF, San Beda, and also as a volunteer consultant in UPPGH. And this mentorship opened the doors until I transferred to where I work now, the Southern Philippines Medical Center in Davao City. I'm very thankful for my family and community medicine education and background because it has really prepared me for the role that I am handling now. So mainly, being the Chief Training Officer and heading the Professional Education Training Department of the Southern Philippines Medical Center, a 1,500-bed hospital in the heart of Davao. Family and community medicine residency prepared me to become an educator, and I learned from the best. So it's easy to do this role because I've learned how to evaluate, to do instructional designs, to counsel mentees, to help them assemble portfolios, to help them clarify what tasks they need to improve. And this is something that I carry on with the work I do today. So the educator role is something that I continuously embrace. This role also has led me to become an administrator. And how did the family and community medicine help me do that? Because they exposed me to leading programs. Chief residency opportunity also came in. So I learned to manage tasks, prioritize and manage people. And those were the seeds that I helped me to build on the work I do today in SPMC, managing programs, managing also different advocacies, and trying to collaborate with other healthcare partners in order to improve our services for our patients. The other roles I play, maybe to a lesser degree, but it still is one of the many hats I play. So collaboration, especially during COVID-19, and even now as we implement universal healthcare, both internally with other specialists, in order to refine our protocols to make it one. And when there's disagreements, to be the arbiter in order to really, at the end of the day, serve our patients. I also am given the task to collaborate with the Department of Health and other government agencies in order to facilitate referral and smoothen protocols between the hospital and the community. And I owe the navigation coordination roles that not only our family medicine consultants, but our community medicine consultants taught us when we were in family and community medicine residency. And one thing I love, which will always be my passion, which has also been ingrained with me through the rigorous evidence-based medicine training, quality improvement training, and research training brought about by residency, is that I will be always a researcher. I am happy to have engaged personally with the APMC Student Network, I think for 2 years in a row, helping judge their research papers. And this is one opportunity that I would continually like to pursue because I know increasing knowledge in family and community medicine, particularly health promotion interventions, tailored interventions for our different people. So in Mindanao, we have tribe people, we have indigenous people, different approaches. Also knowing about their healthcare behaviors and some healthcare traditions that might also help healthcare become sustainable in their area. Those are the fields you can explore. And the biopsychosocial approaches and the holistic approaches, not only looking into healthcare per se, but the other aspects and how it improves the delivery of services to the patient and healthcare in general. So I'm also glad that at present, I work with the Regional Health Research Development Consortium 11 to evaluate proposals for funding because I also am able to help not only our family and community medicine residents, but other people get funding for the much needed innovative researches in the Philippines, not only in medicine, but in different areas. I will never forget the role of a clinician. Even if I'm admin, I think at the core of all of us is a physician. And during my early years, I had the opportunity to work as a corporate physician, delivering care to the entire families. And I think the satisfaction that they were satisfied with my services is up to now. So I've been away from the company for 10 years, but even up to now, the employees before still message me since they know my number and ask me questions not only about themselves, but about their families or ask for my help to help them navigate services. I still do a little bit of telemedicine work. I think I don't want to forget being a clinician because that helps in the other jobs I do as well. And that helps me to relate as well with our interns and our medical residents who is also under my care. Lastly, as a counselor. So when I was trained how to do communication skills, how to do counseling was also ingrained in me. And this has helped. Even with my admin job now, listening to people, especially at the height of COVID-19, listening to them and their problems and being able to unburden them has helped. So you see, as a family and community medicine physician, there are various roles you can play. And sometimes the comment might be, are you a jack of all trade and a master of none? But again, if you look at the entirety of that quote, it says, jack of all trades, master of none, but sometimes better than a master of one. Because context will ask us to wear different hats. And if wearing those different hats help us to become more flexible, which COVID-19 has taught us, and be more responsive and able to serve, as long as we try to continually hone them, then why not? So I'm almost wrapping up. I think I echo Dr. Samaniego, Dr. Berdin's sentiment that part also of why I chose family and community medicine is I know that it could offer me a work-life balance. And not only that, I really have very, very understanding colleagues even now, since they know that a happy person will be a person that could best serve. This work-life balance has always been preserved, and this has helped us serve our patients more. So is family medicine the specialty that could deliver universal health coverage? I will leave the answer in your shoulders because I do not want to lift my own chair. This is the definition of universal health coverage. It means that all people have access to the full range of quality health services they need, when and where they need them, without financial hardship. It covers the full continuum of essential health services, from health promotion to prevention, treatment, rehabilitation, and palliative care. And this is the definition I found about family medicine, which I kind of resonate with. It's a specialty devoted to the complete healthcare for people of all ages. It provides continuing and comprehensive healthcare to the individual and family, regardless of age, gender, disease, parts of the body. It is patient-centered, family-focused, community-oriented, emphasizing prevention and health promotion. So I hope I made my case. Also, there are a lot of opportunities for you. I decided that admin work was for me and educating was for me. But there are a lot of specialties that family medicine offers. You could go to palliative medicine as well. You could dabble in toxicology. Geriatric care is open. Being an educator is open. Being a master's in public health, engaging in research. The opportunities are limitless and boundless, and the choice is yours to make. So these are my key takeaways. For me, a career in family and community medicine is worth pursuing. It has been rewarding, whether I was in Manila or now in my home, Davao City. The commitment to continuing coordinated, integrated care across the life cycle and the patient-centered, family-focused, community-oriented family physicians could truly be at the forefront of the delivery of the universal healthcare, and we need more of you. You can opt to exercise really the different roles or focus on one, and I will say anything is better. Pursue that which resonates with your core and skill sets, but at the heart of it, remember, we are doing this to better serve the patients, the families, the communities, and our country. Because if we improve our healthcare system, we improve all our lives at the same time. Then aim to strike a balance. If you are not happy, you cannot promote happiness, and you can also not be able to help. And never stop learning and improving, because that is it. We always continue to learn, and there's always some new knowledge out there to better serve our fellow men. So with that, I have stood in the shoulders of giants. You met two of them right now. And I'm happy because they gave me new perspective. So right now, I think Junjat and I, the middle generation, would love to carry you on our shoulders. I hope you join us to be a family doctor, the heart of healthcare, to provide continuing, patient-centered care, integrated care, and collaborative care across all ages and diseases. Daghan kaayong salamat.
Thank you so much, Dr. Concha, for sharing how this specialty paved the way for these limitless possibilities. And now we're done with our 4 speakers. I am now opening the floors to our reactors. We are very lucky. We have 3 reactors for this session. Okay, let me introduce our former dean at the University of the East Ramon Magsaysay. Currently, she is the chair of APMC National Internship Committee, Dr. Alfareta Tan Reyes. Another reactor is Attorney Joy Agot. Dr. Attorney Joy Agot. She is currently the president of FAPRO, the Philippine Academy of Family Physician Residents Organization. And of course, we also have Dr. Abdul Rayuf Garangan. He is also one of our reactor. He is currently the president of APMC Student Network. So let's give them a warm welcome in our virtual floor. Okay, so probably we can hear first from any reaction or any insights from the sharing of our speakers. Yes, Dr. Joy.
I'll go first. No? Hi, Doc. Good evening, doctors. Happy World Family Doctors Day. So by hearing and watching the lectures, it actually made me realize, it reminded me, the reason why I chose family medicine as the specialty for my residency training. I actually had a short detour to law school after passing the medical boards, mainly because I did not know what specialization to take. But after law school, I applied in the residency training program in San Lazaro Hospital, pending bar exam results. So you know how long we had to wait for the results to come out. And when the results came out and my name was on the list, actually some of my friends thought that I would quit the program since I've only been a resident for about 2 months when the results came out. But one of the reasons why I pushed through and go with the residency training, despite the greener pasture that being a lawyer offers. You know, the entry level for government lawyers, like in PAO, is salary grade 25 already. But in medicine, those in the residency, we start at salary grade 21. So despite of that, it is mainly because of the universal healthcare law, which I learned while I was in law school, and its role in the practice of family medicine in the future. So family medicine will be in the front lines when this new law becomes fully implemented. The role of being a family medicine, which is a specialization with unique blend of clinical skills, behavioral sciences, and communication skills that is grounded in doctor-patient relationship will be of great importance. And according to WHO, it has been estimated that around 75% to 80% of the general population require only primary care services in a given year. So could you imagine the roles that we would take part in once the UHC is fully implemented? So under the UHC law, a primary care provider would act as the navigator, the initial and continuing point of contact in healthcare delivery system. So we will be in it from start to finish with our patients. So the family physician's holistic approach to a broad set of symptoms is not defined by age, sex, organ, or disease, and values patient's perspective. Family physicians do not separate the disease from the person and the person from his environment. The specialty has been at the forefront of primary and secondary care services in many parts of the world. So being the center of primary care, unlike other specialties that are limited to a particular organ and disease, family physicians are the only specialists qualified to treat most ailments and provide comprehensive health care for people of all ages. That is from newborns to seniors. So I also believe that one of the reasons why the Philippine healthcare system did not collapse despite the numerous waves of COVID during the pandemic is because of what was said a while ago, that most of the family physicians was out there providing primary care to those in need, some even doing online consultations. We are out there in the community schools providing health education, thus preventing congestion in the health facilities, thus preventing the collapse of our healthcare. So family medicine, which provides holistic care, know our patients over time, and this is deepened by the knowledge of social and environmental determinants of ill health. So countries with strong primary care infrastructure managed by family physicians like Canada, Australia, have better health outcomes at low cost and have significant better patient satisfaction. So hopefully we will have the same results in our country, and hopefully many will answer to this call. Again, happy Family Doctors Day, everyone.
Thank you, Dr. Joy, for sharing your influences about why did you pursue despite that difference in salary grade, indeed, no? And now I'm so excited. I think we're still waiting for Dr. Tan Reyes, no, in the virtual floor. And for now, I'm excited for this, to hear about from our student, no? I want to hear your reaction. Dr. Garangan, please.
Yes, thank you so much, Doctor. Before that po, Doc, am I audible lang po ba?
Yes,
Medyo ano
yes.
po.
Loud and clear.
Thank you so much. Assalamualaikum po to everyone. That's the way how we greet in our religion po. Good evening everyone and mayong gabi. First and foremost po, let me thank po muna the organizing team, especially our President, Dr. Karin Garcia, for inviting us, especially the students, not to be a part of the celebration of the World Physicians Day. So in behalf po of all the students, medical students in our country and also our medical interns, happy World Physicians Day to everyone po. So for my reaction po with regards to the speeches that were given to us, all of the experiences that were shared to us by our highly esteemed doctors and speakers are really inspiring, and I for sure I can really learn a lot from them. And as you all know, that family medicine and community medicine is a very essential part of our healthcare system in our country. And sabi nga po sa mga experiences ng mga doctors po natin na really the type of health support and health system that we have in our fellow Filipino people, especially to those who are in geographically in the GIDA places, no? These are the places where we really need the type of quality health support and services that we can give to our fellow Filipino people. Now, I think one of the challenges also that we have or that we see in family medicine, particularly, is on how we are going to integrate this and we are going to entice our medical students and to in the future invite them in this field of medicine. And personally, as a student po, Doc, of course, I have already heard about family medicine and community medicine, but for sure, there are still a lot of medical students right now and interns, for say, who are still not really aware or do not have that huge or broad idea of what family medicine, community medicine is. Now, as a student and also as a student leader, I think what the organization or what the family medicine team can do is really to integrate family medicine education, community health medicine education to our medical schools, and not just into our medical schools. We also have to go to all students or to our young generation, even before they enter medical schools. Ako kasi as a student leader, I really see it that leaders are not born. We all know that they are trained, they're educated, and that is also the way we should attack or the way we should introduce family medicine and community medicine to our future medical students before they even enter medical education. They should be aware of what or the situation in our country, especially now our people who badly need the health services, especially in areas who do not really receive these kinds of services. These students, these young generations should really know and understand their situation, and from then on, alam na nila kung ano yung dapat nilang gawin in the future to help these people. And if, like me, even before when I was a young boy, I really wanted to become a doctor, but I did not know, or I do not know what kind of a doctor I want to be in the future. But right now, as a future doctor to the barrier scholar, I'm a scholar but at PB, I'm already looking forward to be in the community area or in the public service of our fellow Filipino people. But yun nga pong sabi ko, for sure, there's still lots of students who are really for example, really curious or do not know or confused on what they're going to do or to have in the future. So yun lang po siguro. These experiences are very, very enticing, very admiring. And siguro the students, if they experience firsthand all the experiences that our esteemed speakers have shared to us, then they really can see the importance and also the magic of family medicine and community medicine. And that's also where the student network can go in. The student network, the door of the student network is always open to the family medicine, to any doors of our medical service to all the Filipino people as we serve them, not just the medical students, but also our fellow Filipino people po. So yun lang po. Thank you so much.
Thank you, Dr. Garangan, no? Parang thank you also for sharing that you're planning to go on community health, no, at while you are still a student, and it's one of your inspiration. And now I want to hear I want to hear from the audience, no, what are their questions, and siguro our speakers could answer, or even, yeah, our speakers could answer the polling questions from our audience. And there are participants, brave souls, who actually raise their hands, no? Can I call in Dr. Maria Teresa Ramos? Are you there, Doctor? Dr. Ramos? Okay. Or Dr. Joyce Yao? So while waiting for those who are raising their hands, I will read the questions posted. Okay. So, I think this was touched by Dr. Alba kanina. What steps are being done, speakers? What steps are being done to change the specialist-oriented mindset of the general public? Many of our young colleagues choose to go specialized because the demand is still there. So any reaction from our speaker? So currently, yung specialist mindset ng ating mga students, no?
But I think
Yes.
the good response was given by one of our reactors, no? The PAFPRO president, Doc Attorney Joy. No? The need of our country, and this has been supported by the Universal Healthcare Law, really is a strong primary care orientation. It's really bigger investments if you go to hospital care, meaning subspecialist and super specialist care, when you treat diseases rather than you prevent and promote diseases. So what is being done? The Universal Healthcare Law clearly supports doctors at the front line. So these are doctors who could see all kinds of people across ages, disease groups, sexes, right? Genders. So this is one of the support that the government is doing. And I think even medical education, they're trying to flip it already. They're trying to look into community orientedness. And even in family and community medicine education, because of practice-based residency training, we want the doctors to be in the communities where they actually are. But we want to give them extra skill sets because we know that, especially now with the pandemic, no, especially the last 2 years, na walang masyadong exposures yung students natin to practical cases. We know that residency training helps, but we want people to be working in their communities, looking at their context, trying to address the problems they have and the skill sets they need. So I think there are moves from government with the Universal Healthcare Law, looking into the changing of the medical curriculum and making it generalist oriented. And I think even the specialists, right? They're looking into strengthening their general aspects. Since I work in the training office in SPMC, I get comments of the accrediting team of the different specialty organizations. And one of the comments that is being thrown now, even for the specialists, is where are your generalists? You have cardiology rotations, you have nephrology rotations, but where are your generalists? So in a way, right now, I think everyone is also looking into a generalist perspective because they know that we really need to answer the greater healthcare need, and that is not very disease or organ specific at this point. And this movement of the PAFP, and thank you, the APMC Student Network, for also doing this orientation to our doctors and the orientation also to the public will help. And I think the best testimony to the public is the work that each and every family physician does, like what Ma'am Abby is doing.
Yes, Dr. Samaniego, you're raising your hand.
Yeah, I'd like to add to that. No, I think even the general public has already opened their minds regarding this, because I get a lot of queries regarding where to get their family doctor. No? For example, I have a friend who is an announcer at the same time, who asked me where he can get the nearest family doctor. So happen na nasa bandang Quezon City, near siya sa St. Luke's. Wala bang family doctor sa St. Luke's? Tapos I was even asked na, sabi niya, imagine mo naman, nagpa-check up ako, may sumasakit lang sa nagche-chest pain daw siya. Napadiretso sa cardiologist. Turned out to be GERD pala. Tapos naparefer siya kung saan-saan. Sabi niya, doktora, napakamahal. Napakamahal lang magdiretso ka sa isang specialist. Sabi ka agad, no? With one type of na hindi na-screen ng isang family doctor. And I tell you, patients are really looking for family doctors. Even those who are rich, no? They're really looking for family doctors. Ayaw nilang dumiretso ka agad sa mga specialist kasi napakagastos talaga. And if you're a trained family doctor, I tell you, no, hindi ka masyadong magre-refer. Kasi alam mo even with derma, alam mo yan, nag-rotate ka kasi dyan, naiintindihan mo. So, been seeing so many of them, kaya magagamot mo siya. In fact, at one sitting, you can see different types of cases different types of diseases in one person with so many comorbidities. A family doctor can treat that. Kaya I think the public is already opening their minds regarding looking for a family doctor. Na bukas na yan. As I see, no, sa tagal na rin ng practice ng ang dami nang naghahanap ng family doctor. And it's going to be the specialist that we really need.
Thank you, Dr. Samaniego. Yes, Dr. Birdie, would you like to add something?
I would totally agree with Karen Trend. Siguro, during my start of my training, that was the parang napaka specialty driven yung, kasi in my batch, there are only 2 of us who are into family medicine, and ilan kami when we graduated. So that was really tell us that time na napaka specialty driven yung as to which path we will take. But nowadays, I would agree with Dr. Samaniego. We family physicians have proven our being the heart of healthcare, because I think across the specialties, it is only us, the family physician, who would really listen, not only to the patient, but as well to the whole family, even the whole barangay, if I may add, because we are trained to really treat our patients holistically, looking into not the PFC matrix, the patient oriented, family focused, patient focused, family oriented, the PFC matrix. Nawawala na ako, no? But definitely with this training, added to our training, the being there, listen, we only have not only 2 ears, but more than 2 ears to listen to all our patients' woes and concerns. And also being a navigator, I don't know if I know most of the family physicians who are practicing now who really experiences that you are caught in the middle of a patient being referred or being handled by a lot of specialists. All system may nag-handle the doctor, but the family would always look for the family physician to listen and hear what would be the next best thing to do to their patient.
Okay. Thank you, Dr. Berdin. Actually, no, hindi lang yung general public, yung specialist-oriented. Indeed, no, kahit during medical school, medyo specialist-oriented din tayo. That's why we are doing this, to show our students kung ano ba yung family medicine practice, no? And I believe so na yung yung ating patients themselves, they are the best promoters of our specialization, no? Once they get help from the family doctors, sila mismo yung magsasabi niyan sa mga kapitbahay nila na itong doktor na to iba siya sa mga doktor na na-encounter ko. So sila talaga yung nagpro-promote sa atin, no? So, okay. Tong question na to. Medyo na-touch din to ni Dr. Samaniego. Pero students, I want to encourage you to ask question ha. Okay? Any clarification, no? So you are very welcome to ask question. So sabi, many of our younger colleagues, this is very true ha, expressed to us that they'd rather not be constrained by training requirements if they're joining, if they're going to just be similar to GPs anyway. What can they learn from FM residency that they can similarly learn in GP or read from CPGs? Yes, nabanggit to kanina ni Dr. Alba, no? Dr. Alba, would you like to re-emphasize?
So, like I said, the good thing about the milieu that you have now, we have practice-based residency. So that doesn't take you away from your practice. But what does residency training add? No? Family and community medicine residency training add? It not only gives you principles, like I said, for the educator part, it teaches you how to organize instructional design, evaluate programs. So those are additional skills. Research part, it teaches you how to appreciate research. And I think the interaction between the mentors and your fellow family and community medicine residents, that environment really enriches your practice. No, I do not want you to look down at the general practitioners, right? Because our practice will be the same, because we will look at all kinds of patients, but the skill sets that will be given to you is additional. Right now, I hope Eileen is here. In the Sorsogon practice-based residency, they are thinking of adding skills like primary care surgical skills for those family and community medicine residents practicing in far-flung areas where they need to first intervene. So you see, those additional skill sets, you cannot get them from reading a clinical practice guidelines. And sometimes the clinical practice guidelines, when you read it, they are guidelines. But in experience, your patient is a complex person. It doesn't follow the guideline parameter. So that experience with a mentor, with discussions, helps you make decisions that may be nuanced with the patient's condition, the family and the community's capacity to provide the resources. And those are the things that you learn further from residency training. Yung rigors, it teaches you extra discipline. And in life, we always need that.
Okay, if I may add, no, not just you learn from your co-residents as well as with the other doctors that you will be interacting during your rotation in their field, no? Actually, I heard this a lot, no, that family doctors are like super GP. And I don't take that as offensive, no? I take it as double positive, no? Kasi being a GP is hard. Tapos dinagdagan pa nila ng super GP. So double positive for that. Okay, I think the question regarding DTTV had been answered already at the chat
Goldie.
box. Yes.
Yes, can you please call Dr. Nicodemus?
Yes, yes. Yes, ma'am. Yes, Dr. Nicodemus.
Hi,
Yes.
good evening.
Yes,
Okay,
evening,
so I would like to answer the question about what's the difference if I'll take residency training or just be a GP. You know,
Okay.
when you go to training, you deep dive into the discipline and the science of generalism. If you're a GP, yes, right, you can just read the CPG and do it. But we do beyond just applying guidelines. So we're training our trainees to be more into interprofessional practice, how to deal with complex condition and harnessing potentials of all other specialties. But we will be at the middle to be a coordinator of care. You cannot do that if you don't train, because you need to have more practice and you have to develop the skill sets. We are teaching our trainees for quality assurance, because you cannot just provide care without thinking about patient safety, making sure that the care that we provide would be at the topmost level of care, so that the benefit of the guidelines that you read would be at the maximum. And not only that, the context of people, family, community. It's hard to just say, I am into community-oriented care if you don't practice it and do it and get the foundation and the science of it all. So the residency training is definitely a specialty training, also similar to other specialty training like cardiology. They know very well the beating of the heart. So family physicians know very well patients and the families. And we cannot even contest how our family physicians would do their best to do that. So I think that's the value of going into residency training. Now, in other countries, like in the United Kingdom, they use GP as a term for family physician, because general practice in itself is a practice. But in the Asia Pacific region, we use a family and community medicine, or family doctors, that we are celebrating tonight or today. And because of, the training that they went through. And we will not stop in just residency training. We have continuing professional development. I think Dr. Lipando presented the continuum, and that's the value of going into training, the lifelong learning that you learn when you go to residency. So there are a lot of advantages. Definitely sacrifices will be asked from you if you go to training. I think that's what I can share for tonight. Thank you, Goldie.
Thank you, Doc Lani. May I call on Dr. Vinny Defensor Mina? I think Doctoria would like to add something. Dr. Mina? Oh, Dr. Samaniego, are you raising your hand?
Yes. No?
Yes, please.
Just a sharing lang, no? Right now, before I used to be the only doctor in the clinic that I have, no? Kasi nag-evolve na siya. And yet, we are several family doctors in one clinic right now, kasi may edad na ako, no? And one thing I realized, Luca, yung sinasabi nyo na GP as against a trained family doctor, the clinic would open as early as 7:30. No? And at the end of the day, we realized that ang clinic is 1 block away from the health center. Yung health center, nagka-cut off. Once na nag-cut off yan, takbuhan sa amin. Or magre-request, most doctors at the health center are GPs. Okay? So pagkatapos doon, no, magre-request sila, after na request sa laboratory, takbuhan sa clinic. So what is in us who are trained family doctors, na from the health center na puro GP, takbuhan sa amin. So there must be something in our training, puro trained family doctors, diplomates, fellows, kasama ko sa clinic. So there is a big difference between those who trained and those GP who did not train. So I think training is really very important. Even if you know the practice guidelines, there's a big difference between using the CPGs and actually using it in the patients that you see. Magkaiba yan, no? Kasi iba-iba yung mga pasyente. As I've been telling students, you see patients, no? Especially during interesting case presentation of students. O sige, pare-pareho yan, acute respiratory infection. But there is always something in that acute respiratory infection that is interesting and then that is different in others. At hindi yan nakikita sa CPG. So it's only a trained family doctor who can see that and identify that. So I'm sorry, students, but do not say that a GP is similar to a trained family doctor. It's very different. Kasi ngayon as I see it, kasi nga di ba na kami, puro kami trained family doctors, tambak ang pasyente namin. Hindi kami nawawalan. So after from the health center na sinasabi nyo, GP, no, yung gaganyan-ganyan na ilabas. After doon, takbuhan sa amin. So there is something wrong. There is something in training. No? You must really undergo training as a family doctor para ma-experience nyo the real life of a family doctor. No, para ma-enjoy nyo siya. Kasi it's only the training that you will realize the importance of a family doctor.
Thank you, Dr. Samaniego. I think I want to hear last reaction from Dr. Eileen Espina. Doc I.
Good evening, Goldie.
Yes, Doc.
And first of all, congratulations for the team that organized this webinar. I couldn't help but makisawsaw sa usapan. That comment is really something that I myself has been grappling with. Ano bang pinagkaiba ng why do I need to train in family medicine kung ang ending ko naman is I will be a generalist? So that is something really that I think it's one of the reasons why a lot of medical students are also asking themselves na bakit kailangan ko mag-train in family medicine? It's because the specialty offers much more than forgive me for saying this, pero I think it offers much more than what is seen. Sabi nga, The Little Prince, di ba? What is essential is invisible to the eye. And I myself, I did not start out as a family medicine specialist. I will be honest, I started in internal medicine. Then somewhere along the way, I quit residency training in internal medicine. And then when I wanted to go back to training and I had to choose what kind of training I would want, I too grappled with what Ma'am Abby said kanina about I was then married at the time. So ano ba yung best option for me? So I said, and I look at my practice, I said I will be practicing in the province. So I think the best option would be family medicine. Because in the province, ang practice naman talaga is you cannot really choose patients. Kung sino yung dadating sa pasyente mo. And it's really the kind of care that you give. And people out there don't really differentiate. Basta doktor ka, doktor ka. They do not understand, nor do they care about all those titles. What they care more is how you take care of them and how you interact with them. So at the core of family medicine, I believe, is the compassion that we give to our patient. And that kind of compassion is something that I have seen and I have observed in all my mentors. And that kind of role modeling is something that you learn or that you imbibe during residency training. It's those interactions with your mentors that's the hidden curriculum. And that's one of the advantages when you go into training. And the wisdom that our mentors would share. I have been a pioneer in practice-based residency training for municipal health officers in rural and remote areas. My trainees range in age from in late 20s. So these are people who have been moonlighting. I have MHOs who have been in practice for 25 years or more. And they have various reasons why they wanted to go into training. Some of them, it was unfinished business. They said that this is something that they wanted to do for themselves. They couldn't train at the start of their career for various reasons. And so when we offered them the opportunity to train, they grab it and they have had no regrets. I wonder, I don't know if Dr. Gia is here. Dr. Gia has compiled a lot of sharings and insights from our trainees and even from my trainees in Northern Samar. It's very heartwarming when I hear my trainee who has been in MHO for 25 years in a third-class municipality. Nagsasabi siya sa akin na the training that he had in our program boosted his confidence, knowing that he is able to give his patients in their third-class municipality the same kind of quality care that patients receive in Metropolitan Manila. A patient of his went for second opinion to the Philippine Heart Center, and his patient was very happy because his patient came back, and he told my trainee that ang galing mo, Doc, because the consultants in the Philippine Heart Center told him that the treatment regimen that he was on was at par. So this kind of fulfillment is something that my trainees who have been in practice for the longest time was actually craving for. And also their exposure to other primary care physicians in other parts of the world. I brought them to participate in world conferences, in WONCA conferences, and they saw that being in this community of practice with kindred spirits boosted that feeling that you are not alone, that there are many other people who share the same love and compassion for being of service to the poorest of the poor, to the last, to the least, and to the lost. And this is what makes us the heart of the healthcare system. So I know it's a hard sell, but I didn't start out as FM. But now I'm already on more than 20 years of practice as a family physician. I have no regrets choosing this path. Thank you, Goldie, for the opportunity to share.
Thank you, Doc I, no, quoting Pope Francis, the heart for the last, the least, and the lost, indeed, no. I think this has been a very fruitful night. Some questions are still in the chat box. We'll try to answer it. Dear students and trainees, no, but our time is up, no. Hopefully we can, with this short period of time, that battle cry that we are the heart of the healthcare has become palpable for our dear students. And for now, we are going to hear, to close this up, we are going to hear from Dr. Maria Lorena Di Lorenzo, the Chair for Basic Medical Education. Go ahead, Doc.
Yeah, good evening, everyone. So I hope that you could hear me loud and clear. I'm sorry that I cannot use my background because I have been having technical difficulties here. Can you hear me loud and clear, po, everyone?
Yes.
Yes, Doc.
So hearing our students now ask questions and the exchanges, and I think they are really very inspired by the passionate answers of our mentors, our doctors, our speakers for tonight, and also our reactors. You know, family medicine is really a unique discipline. And from our esteemed speakers, Dr. Leopando, Dr. Samaniego, Dr. Berdin, Dr. Concha, and of course the reactions from Dr. Nicodemus and all the rest, Dr. Espina. So from them, you would see that the practice of family medicine really encompasses the womb to tomb holistic care, and care that is patient-centered, family-focused, community-oriented. And that, you know, we really care for the families, and families are the basic units in our society. So you have heard many reasons why you should or you could make this as your career option. So when you become future clinicians, and like what they said, no, and in their experiences naman, although they have not really started out, no, na choosing family medicine, no, but when they chose it, no, parang no regrets naman din. And you know that I think the practice is really very relevant, especially no, that we are into primary care, and the universal health care, no, is in full swing already, no, and being implemented. Now, no, I do not want to sell it like I'm selling candies, no, because remember that it's still your choice, but with the relevance that you have really maybe heard, no, from straight from those who really are practicing family medicine. No, you know, in the future you might maybe
Hello.
the 6 stars of the family physicians, you know, might also be aligned to your stars, no, and you could choose to become a family doctor. Okay, so again, so and that's what we have, no, as theme in our family World Family Doctor Day, you know, the family physicians, the heart and the healthcare, and I guess that's really true. And with that, no, I hope that you will be inspired, and then in the future you could become our colleagues as well. Okay, so thank you very much to the organizers, and thank you to everyone here in this Zoom link. Have a great day, po. Good night.
Okay, thank you so much, Dr. Lorenzo. And that's it for everybody. Hopefully, we learn a lot from today's webinar. And hopefully, some of you guys, we can say hello to you for entering this kind of specialty. Okay, and we will welcome you with an open heart. So that's it. The webinar evaluation form is posted at the chat box, no? And thank you so much, dear speakers, attendees, and until our next webinar.
Hindi ikaw, may kausap ako. Sige, ibigay mo sa akin pangalan ng gamot, tsaka kung ilang milligrams. Oo.
Good night po.